Okay, well, we can get started. And all of the links that I will be presenting in these kind of the introduction slides here in a bit will be put into the chat afterwards. And then we will move into our presentations. So thank you all so much for joining us today. So we will just do a few introductions and announcements, and then we are going to move into our research intern showcase, which I am very excited to have a couple of our amazing interns that we have here at the DISC present on a project that they have been working on during their time with us. So we will hear from Keisla and Ancheta on the development of EPIS-based data collection instruments through a scoping review, and Marcella Chan, who is going to be talking about assessing community engagement using an ethnographic approach. And after the presentations, we will have time to discuss and ask questions. However, if you have a question, feel free to put it in the chat. We will be monitoring the chat throughout, and we'll be helping with the discussion. We have our DISC leaders, two of our DISC leaders on the call, Dr. Lauren Brookman-Frazee and Dr. Greg Ahrens, who will be helping me with the discussion. And I will give an introduction to myself as well, because I see we do have a few new attendees today. I'm Kara Swanson. I am the manager for the UC San Diego Dissemination Implementation Science Center. And I'm also a first-year doctoral student in the new PhD in Health Services Research and Implementation Science at UCSD. And in my role as the DISC manager, I supervise our DISC interns. And so I've had the opportunity to work with Marcella and Keisla, and I see Olivia, who's another one of our interns, is on, and Catherine very closely. So I just want to promote our January DISC, InStep, and IS Hub seminar. So we are going to be having our visiting scholar, Dr. Li Jingyan, present on improving primary care-based stroke management in rural China. She's going to be discussing a hybrid type 2 effectiveness implementation trial. So I think that will be an incredible way to start off the new year. And I will put the registration link in the chat if that is something that you're interested in attending. So we're looking forward to that on January 15th. We will be having our EPIS office hours January 13th at both sessions. So session 1 is at 8 a.m. Pacific and session 2 is at 4 p.m. Pacific. And this is just a really great way to connect with Dr. Ahrens and myself and ask any EPIS question that you might have, learn from other users, as well as kind of hear about how the EPIS framework is being applied.
Oh, and Kara, I just wanted to say, so I also spoke to Rebecca Lane Nicole today, who's also an EPIS expert and really responsible for the whole bridging factors construct. And she's going to be joining us sometimes. And then Erica Crable will be back after maternity leave. Congratulations, Erica. She's a four-week-old baby boy, Jack, that we're excited about. And Marissa Sklar also supports the EPIS office hours. So thanks.
Exciting. I'm so excited for this upcoming year. We've had some really great attendees, and I feel like we've learned a lot about work that's being conducted here in the United States, but also abroad, and seeing the different applications has been really, really interesting as well. So this is a save the date announcement for the CERC 2026 conference. It's going to be September 25th through the 26th in Minneapolis, Minnesota. I am very excited. I have only been to the airport. However, the airport is very nice, so I could only assume that the Hilton in Minneapolis will be just as nice. So more information on that to come, but we just wanted to give you a heads up. And then now I would love to introduce our speakers. So, Keisla Ancheta is a research intern with the DISC at University of California, San Diego. And she's been with us since January 2025. She's a recent graduate with a Bachelor's of Science in Global Health and a minor in Ethnic Studies from the University of California, San Diego. Throughout her time with the DISC, Keisla has supported many projects, including the scoping review, which she'll discuss today. She also helps manage our DISC social media accounts and develop flyers, social media content, and educational materials that we share on our website and through conferences and on social media as well. And she is also part of the ethnographic analysis that Marcella is actually going to be talking about today of community engagement meeting recordings. Keisla hopes to pursue a professional path in public health that uses implementation science to improve health interventions for chronic disease prevention and management among underserved and minority communities. So today, Keisla is going to present on the development of EPIS-based data collection instruments, scoping review, and will be providing key takeaways. Marcella Chan is a fourth-year undergraduate student at UC San Diego, majoring in public health with a concentration in epidemiology and a minor in bioethics. She started her DISC internship in June 2025 and has significantly contributed to a variety of projects. Marcella has worked with me on developing translational science benefits model impact profiles for one of our partner organizations, the Center for Community Engagement or Community Health. And she has helped coordinate the Advancing Community Health Center Research Priorities Work Group, a collaborative initiative involving community partners and academic researchers with Dr. Borshika Rabin, another one of our DISC leaders. And has worked closely with Dr. Rabin and our DISC fellow and my fellow UCSD doctoral student, Isaac Bouchard, who's on the call as well, on the MUST-D project, which she's going to be presenting on today. Marcella has really driven to explore how innovative technology can support chronic disease adherence through implementation science principles and hopes to bring her skills and curiosity to industry. And I will say Marcella has been joining our meetings with our industry partners and friendly contacts to kind of learn more about how implementation science can help improve the work that's being done within that sector as well. So now I'm going to hand it over to Keisla, who's going to start off our presentations. And I will stop sharing my screen and Keisla, go ahead.
Okay. Sounds good. Let me share my screen. Can you see my slides okay? Like it's my slides.
This
Yes.
one is you just need to do the presenter.
And then
There we go.
it's full screen now.
Yes.
Yeah.
I think,
Okay.
yeah.
And you can just see the slides. Okay, perfect. Hi, my name is Keisla Ancheta, and I will be presenting on the development of EPIS-based data collection instruments, the scoping review, and some key takeaways. So here's my little agenda for today's presentation. I will be giving a little introduction about myself, and then I'll go into the background on the EPIS project, and then my primary responsibilities on the project. And then lastly, my key takeaways from my experiences working on this project and at the DISC. So I'll give you a little introduction. A lot of what is going to be said, Kara kind of said already, but bear with me. I graduated earlier this year with a Bachelor of Science in Global Health and a minor in Ethnic Studies from UCSD. During my undergrad, I was able to learn a lot about the different concentrations and disciplines in public health. I was able to gain experience in health promotion when I was on the social media team for UCSD's Bachelor of Science Public Health program, the BSPH. And from there, I grew interested in gaining experience in research and learning about new different fields, different disciplines in the public health field, which led me to join the DISC during my fourth year, and now I've been at the DISC for about a year now, which is really exciting. My responsibilities at the DISC include managing the DISC social media accounts and creating the promotional flyers for the DISC. As Kara mentioned earlier, I'm also an intern on the Episcoping Review, this project that I'm presenting today, and the Must-D project that Marcella will be presenting later. So, moving on to the background on the EPIS project. For our research question, we are interested in seeing how the exploration, preparation, implementation, sustainment, the EPIS framework, has been applied across different contexts. And this includes key characteristics of assessment instruments and tools, like the DNI models web tool, adaptations to the EPIS framework, and EPIS phases, contextual factors, and determinants will also be assessed. On the right is a picture of the EPIS framework itself and a little overview of the EPIS framework. It highlights key phases that guide and describe the implementation process. It also characterizes common and unique factors within and across levels of outer and inner contexts across the phases as well. As you can see, there's the bridging factors in the middle and the nature and the role of the innovation or practice being implemented as well, the innovation factors. So for the scoping review, we are trying to identify and review research articles that cite either of the two foundational articles on the EPIS framework, and also that describe the development of data collection instruments and adaptations to the framework. For example, we're going to be looking at a lot of interview guides, focus group guides, and surveys that are based or that use the EPIS framework for development. So once we identify these articles, we will be also extracting detailed information about them and about these instruments to contextualize them and also obtain a copy if available. So the goal of this scoping review is to create a repository of EPIS framework specific tools and instruments, and also to help the use of the EPIS framework in a more practical way in various settings. So we currently have 4 steps in the review process. Step 1 is defining the search strategy. So here are our 2 target articles for citation searches: the 2011 Advancing a Conceptual Model of Evidence-Based Practice Implementation in Public Service Sectors, and the 2019 Systematic Review of the EPIS Framework. The search databases that we are going to be using for our scoping review are going to be Google Scholar, PubMed, Web of Science, and Embase. For step 2, it's our screening process. So our inclusion criteria for these research articles will be whether it cites the foundational articles, whether it developed a tool or instrument based on the EPIS framework, and if it is published and peer-reviewed. For step 3, this will be the abstraction process, where we will be extracting more detailed information on the articles that do meet that inclusion criteria. In step 4, this will be tying everything together. It'll be the reporting and summary, where once we have all the articles and have them identified and information extracted, this will be where we report and summarize. We are currently on step 2 of the screening process. So next, I will be talking about my primary responsibilities on this project. I assisted in designing the searching protocol, and I was also assigned the 2019 systematic review article for the screening process. In the initial screening, every article or search result that came up in the database that we were using would be inputted into a standardized initial screening database. And from there, we decided which articles will move on to the secondary screening process. We are currently on this step, and so far I have 2 out of the 4 databases screened, and I'm currently working on the 3rd database. On the right is a table, which is an overview of the amount of search results that came up in each database, citing the 2019 systematic review article and using the search terms that we came up with for those databases. So far, I've completed the initial screenings for Web of Science and EPIS, and I'm currently working through the 500 some initial screening for PubMed. In our standardized initial screening database, which you can see a little example on the right, the image on the right, we include the citation of the article in APA format, which foundational article it cites, whether it's 2011, 2019, or both. And since my article is the systematic review article of the EPIS framework, I often have both for most of the articles that I find. Whether it's unique to the database or a duplicate, the name of the database that we are searching, the title, abstract, screening decision, whether we choose to include or exclude, or if it's unclear so far, and any initial screening notes. So I don't know if you're able to see, but for like the excluding decisions, I would put notes saying that it doesn't develop any tool or adaptation, or it only uses the EPIS for analysis. And then for including, it's mostly the structured question guides or interview guides that I mentioned earlier. And now for my key takeaways. This project and my experience at the DISC has provided me with a lot of opportunities. One, I would say, is my gaining new experience in research. I had no experience in research previously, but I really was interested in seeing how research in public health is different than research in general. And I gained a lot of experience through this process of conducting a scoping review and also conducting a literature review that helped support the development of the scoping review. And I'm very grateful for this experience. Next, I was also able to engage in D&I research. Throughout this project, I was able to read through a lot of interesting articles about D&I research, and I found it to be really interesting. And I was also, this project provided me with a foundational understanding of EPIS, which is a widely used implementation framework, which I know is really good for me to know as I continue my education in implementation science and public health. And lastly, the DISC has introduced me to the field of implementation science, which I hadn't known before, and has inspired me to pursue this field in my professional career. Which brings me to my next steps. Currently, I'm in the process of applying to graduate school. I will be applying for my MPH, Master of Public Health. And this is because I really wanted to further my education in public health, which I know is what everyone says, why they choose to go into grad school. But I think I do want to become a leader in the field, and this is my first step towards that. And the program that I would really like to attend is UCSD's MPH with a concentration in health behavior. In health behavior, I would be focusing on behavioral, social, and cultural factors related to individual and population health and health disparities. And that's really what my initial interests were throughout my undergrad, was health behavior. But now learning about implementation science, I have a new mission, which is to use implementation science to improve health interventions for chronic disease prevention and management among underserved and minority communities. And my personal career goals is to work in program management in public health. I'm still learning about the different career paths in the field, and I hope to learn more during my graduate studies. But so far, I love where my interests are, and I'm excited to continue working in implementation science. So I'm just really excited for what is to come. And that's it from me. I would like to thank Kara, Isaac, and Marcella for making my experience at the disc very enjoyable. And thank you all for your time. So, yes.
Thank you, Keisla. That was so great. I will just kind of save some time right now for any questions, any comments. We could spend, I think we could probably aim for about 10 minutes of discussion questions if anyone wants to unmute. Lauren, you want to kick us off?
Yeah, thank you so much, Keisla. This is really terrific. We appreciate all the work that you've done for DISC and for joining the DISC. This was a big project that you've taken on, and I really like how you talked about how it's kind of influenced your career. And I'm just curious how, the working on this project has, was there anything that's like what you learned about research that was unexpected kind of embarking on this project, what challenges you found as you've worked on this project?
I think when I first joined the disc and I first started like doing research, I didn't realize how, I wouldn't say repetitive, but I didn't realize how tedious some things can be in the research process. But I kind of enjoy like detail-oriented work and I don't mind tedious work. So I thought that a lot of the things that I was learning while I was researching EPIS articles was kind of just fun little public health things I didn't know before because I was just looking at research articles and I thought and sometimes I would find articles that I would be really interested in and that I would save and read later. So I was just surprised at how much information is out there that I did not know before. And I was really just excited to see that there's a kind of field where it's like research that I can just see an overview of a lot of parts of the public health field that I didn't know before. But yes, I don't know about challenging, maybe just the tedious stuff, but it's still a little fun, I think.
I love that observation about kind of that it can be tedious, and that's part of that might contribute to the rigor of research and being detailed oriented, but that it sparked your interest and your career. So thank you for your work and for sharing where you are.
Thank you for your question.
Yeah, I have a question, but first, thank you, Keisla, for being engaged in this process that I think is probably going a little deeper and more articles and more activity than maybe was anticipated from the beginning. So that's good and bad. It's good that there's so much use of EPIS framework and citing of the EPIS framework. On the other hand, that means there are many, many, many articles and published papers that you need to go through. I'm wondering about your experience in social media as well, and I'm wondering what your thoughts are about social media platforms and strategies would be most helpful in supporting access to information about the EPIS framework and for extending the reach of EPIS.
Um, I I I know I have a lot of, well, technically, a lot of my undergrad experiences in social media and marketing, but I'm still working on and interested in seeing how implementation science can be better disseminated using social media. And I think Karen and I have been working on trying to just disseminate this information with social media. Seeing how many people are here right now, I feel like it's working pretty well. Um, but for the EPIS framework, I didn't learn too much about implementation science through social media, but once I have began looking into the field, I have seen more posts and social media work within other like frameworks. Like the Re-aim framework I've read about on social media sometimes. So I think just maybe occasional posts and stuff about the frameworks would go a long way just to have exposure out there. But that is a good question. We will work on promoting the EPIS more on social media.
Great, thank you. It'd be great to have your skills and experience working in that area. Thanks.
If there's anyone that wants to come off mute or put a question in the chat or comment, please feel free. We're good with waiting in silence.
Yeah, and I think we can also take more questions at the end for all of our presenters. So yeah.
Keisla, I did have one question. Out of all of the articles that you've reviewed so far, and I know it's been a long time coming with this, is there an application that you've read that you found particularly interesting? Maybe how the EPIS was used for a specific study? I guess kind of thinking about all of those articles, was there anything that kind of stood out to you in how this framework was applied?
I am not too sure at the top of my head. I might have to come back to you about that, like at the end. But I think a lot of the articles working with um children with autism or mental health disorders, I think the applications of EPIS during those interventions or during those projects I found myself to be most interested in. I think that there's obviously a lot of applications in like hospital settings or community-based settings, which I find interesting as well. But I think mental health and mental disorders were just the most fun to read about, I think. Um, but yes, nothing at the top of my head. But if that answers your question, then yes,
Yeah.
mental health.
Great. Yes. Okay, fantastic. So with that, we can hand it over to Marcella. And let me just pin you, Marcella. Um, and you can go ahead and share your screen.
You guys able to see it?
Yes.
Okay. Okay, hi everyone. So today I will be presenting on the Musty project on assessing community engagement using an ethnographic approach. So a little bit about me first. I actually was at Hawaii Pacific University my first 2 years. I was mainly there for soccer, but I was still studying public health. And then I decided to continue at UCSD because I felt like my academics were becoming very linear at HPU and I wasn't being challenged enough or exposed to any opportunities beyond the classroom. But I knew here at UCSD I wouldn't have to worry about that. And soon enough, I joined a volunteer organization called Youth Empowerment in Science, which aims to inspire a passion for science in underrepresented areas of San Diego by developing and implementing hands-on workshops in elementary schools. And this picture I put in the middle is from the first workshop I volunteered at. It was a neuroscience workshop where we used pipe cleaners and a tabletop Tesla coil to kind of represent a neuron to the third graders we were presenting to. And last year, I actually had the opportunity to take a public health course at UCSD. It was PH 155, Qualitative Research, with Dr. Fielding Miller, where we explored qualitative methods for collecting and presenting data. And during this time, Dr. Fielding Miller was actually in the beginning of starting research on the effects of the NIH budget cuts on research across the country. So I was able to be a research volunteer for a short period and collect data on all the institutions that were heavily impacted on this. And I realized after that, I wanted to explore more hands-on workshops or more hands-on experience in real-world settings. So to explore what exactly dissemination and implementation science was, because I saw this was an opportunity for PH 198. And I wanted to see how it can intersect with my own interests of chronic disease treatment adherence and innovative technology. And this led me to my current position now as a student intern for the DISC and the project that I have been working on the past few months, Musty, which I will be talking more in depth about. So a little background on the Musty project, and a quick note before I jump into this is that I'm presenting on the current state of the study. This project isn't complete yet. But the aim of this project we call Musty is to track social determinants of health and symptoms of depression among federally qualified health center patients. And the importance of doing so is that it provides evidence that is necessary to inform public health implementation decisions in community engaged academic settings. And the problem that we are trying to address is communication and engagement between communities and academics. And the approaches that we used was a mixed methods approach, so qualitative and quantitative analysis. And the qualitative approach was utilized for thematic coding and ethnography, which can be seen in the screenshot of our Excel spreadsheet that we used when documenting the meetings. And the quantitative approach was used when we performed the analysis after the documentation was complete for meetings 1 through 4. And I was able to take the different types, themes, and codes and transform it into data tables that summarized total findings. And for the population, we had a total of 9 different groups. So patient health navigators, study researchers, facilitators, admin operations, data office, mental health providers, English, Spanish, and Arabic patients, and student interns and interpreters. And then if you look at the screenshot I inserted, if you look under the group column, we have the numbers listed 1 through 9, and that associates whoever the speaker is and which group they're affiliated with. And so an overview of my primary responsibilities, I co-led documenting meetings 1 through 4 with Keisla. So for each meeting, she would document one half and I would document the other. And Keisla and I identified each act with a specific type of communication pattern. So it was either giving information, seeking information, suggestions, endorsement, summation, and or closing. And then I assisted in the codebook we created as well that highlighted specific themes and codes for those themes also. So in total, there were 4 themes and 13 codes that we used to code each specific act. And I was also responsible for analyzing the types of interactions across all meetings and analyzing the theme code frequency across all meetings, which I later then produced tables for that highlighted important findings. And I'm also going to cover all of this more in depth too throughout the presentation. So for the thematic coding, I included on the far left a screenshot of part of our codebook. So if you see in bold underlined is co-creation sessions. So that was our theme. And then under that, we have other sub-themes and codes. So we have generating feedback, co-create instruction and clarification, facilitating discussion, recap of ideas from past meetings. And the screenshot in the middle is from one of the meetings we documented using that codebook. So the theme column has one of the 4 themes, and then we select which codes from that theme in our codebook fits that specific act for that speaker. So for example, the first act at the top of the screenshot, if you read it from left to right, the theme identified is co-creation sessions, and the sub-theme or code is generating feedback. So we did this throughout all meetings 1 through 4, and after analyzing the theme code frequency and creating a data table, I extracted the total percentage from each theme, so each of the 4 themes, for when it was used, and I put it into a SPSS pie chart, which you're seeing on the right. And the pie chart shows the highest being 62.4%, which was co-creation sessions in that light blue color. So that dominated thematically, but if we look at other important findings, this is the preliminary findings. And these are the initial findings from meetings 1 through 4. And we can see that study researchers appeared the most in giving information and minutes spent talking compared to patients. But we hope to see these numbers shift after relationships have been built throughout further meetings. So graph 2 on the bottom left highlights only the type of interaction of giving information. And after I analyzed all interactions across all 4 meetings, I saw that giving information had the highest engagement, and it was from study researchers and facilitators, as you can see in the light blue bars. And in red, you can see the patient groups. English, Spanish, and Arabic speaking patients had the lowest rate of giving information as of now. And if we compare that to the bar graph on the right, I extracted these specific groups from the data table that Keisla analyzed and came up with study researchers in the green bar, having the most minutes spent talking in total across all 4 meetings. And in gray, again, we can see the same 3 groups, English, Spanish, and Arabic speaking patients, having a significantly lower total minutes spent talking compared to study researchers. But the findings from each graph is likely due to researchers and facilitators giving instructions and explaining the overview of MUST-D and what they will be doing on their end so that the patients get a clear understanding, which explains why the numbers are drastically different between study researchers and patients as of now in these beginning meetings. But some adjustments for future sessions to make sure that the next meetings prioritize activities that engage these patients is to focus on centering patient engagement to minimize these large gaps. And what this might look like is involving patients in planning meeting topics and goals to ensure relevance for agenda in each meeting. This way, patients have the opportunity to speak on familiar topics versus just them receiving information from facilitators and study researchers. And then a major key takeaway from this is how much this ethnographic approach was able to capture between these groups and focus on real behaviors, which helped reveal improvements that prioritize activities with patients that promote equitable engagement. And then going on to my own interests, I wanted to connect MUST-D and this experience overall to my own interests. So I created this little Venn diagram. So I have ethnography at the top, and then chronic disease treatment adherence and patient safety, and then innovative technology. And in the middle of all these 3, the way I see these different ideas aligning is using this ethnographic approach to guide new and advancing technology in order to improve and be part of the step to better adherence and patient safety. And then my next steps, building off that, I also wanted to mention again how MUST-D and the DISC in general is helping me move forward in my next steps in academia and career path. And I hope to further explore the intersection of D&I and innovative technology and chronic disease adherence treatment through the Master of Public Health program here at UCSD, which I have applied to this past fall. I'm specifically interested in the technology and precision health concentration. This will support my interest by applying ethical principles for emerging technologies like AI in order to design and evaluate population-level interventions. And being part of MUST-D has also opened my eyes to how unfamiliar people are to D&I in general, me being one of those people before I joined the DISC, but also how much room there is to use D&I methodologies to support effective translation into real-world practice. And that's what I want to be part of in my next steps, is demonstrating and introducing these techniques like ethnography to possible biotech industries. And the way I see it is that the biotech and big pharma companies are creating new vaccines, devices, and diagnostic tools. And I see implementation science playing the role in this process by making sure that these new innovations actually get adopted, scaled, and sustained too in real world settings. And some takeaways from this, kind of reiterating what I just talked about, but this process to communities beyond just new research findings is super important, but also seeing evidence becoming more of a routine practice for FQHCs and also on our end as study researchers. And then also, I think Mustia has given me great experience on more of the qualitative side of research versus just the quantitative side, because I think as public health undergrads, we get a lot of that experience in quantitative through biostats and like epidemiology, but I gained a lot of experience in exploring ethnography, which has really given me a deeper understanding of the qualitative side. And just the new idea that has stemmed from this opportunity, Kara briefly touched on it, but I've been able to sit on a few meetings with someone from Amgen, who is a thought leader engagement role in a rare disease business unit. And they're trying to find ways to possibly collaborate. So, how can DNI be used to help him with this project? And is there any possibility for an implementation project that solves for care gaps and care pathways? Which made me think about this idea, and that is there any opportunity to collaborate using ethnographic insights to better understand and improve compassionate use program implementation, especially around gaps in patient access and care coordination? And then just my little advice to you that my capstone teacher told me was to know which doors to open, know which doors to go through, which to keep open and which to close. And I think this is important to fully lean into all opportunities that you have. I think having an open mind going into a lot of things will help you in your career path, as it has helped me going into being a student intern for the desk. And I would like to acknowledge Isaac Bouchard and Keisla Ancheta. Thank you, guys.
Thank you so much, Marcella. Feel free to unmute. Any questions, comments?
Well, I'll jump in again. Marcella, this was so terrific. Again, I really appreciate you talking us through the work that you did, but then also how you're reflecting and integrating that into your ideas about where you want to go and kind of the meaning that you're making out of this detailed work. You had the opportunity to be kind of the fly on the wall in these kind of community engagement sessions. So, which is different than being part of those discussions, right? And I'm just curious, kind of, you were doing detailed coding of what the interactions between multiple people were. So I know you are focused on the details. If you kind of zoom out a bit, do you think you could comment? So I guess two questions. Can you comment on to what extent you thought that the distribution of time and who was saying what kind of made sense for the meetings, you know, how they were structured? And then if you had any ideas that you could give either researchers or other people who are engaging communities in like where there may have been opportunities to facilitate more communication from patients. So, because those are my questions for you.
Sure. Yeah, I think as of now, for the meetings that we documented, it makes sense that study researchers are more so dominating these meetings. But I think from a wider perspective, I realized that the way most of the meetings were structured was study researchers and facilitators going over the agenda and introducing these new topics, and then kind of leaving like the last maybe like 20 minutes to be like, okay, patients, like, here, like, what's your feedback? And then I think patients had a lot of insight of what they needed more from FQHCs or what they wanted to see more of. But I think there was a time crunch where it's like kind of started to rush. And so I feel like we weren't getting the full perspective on the patient side. So I suggested including maybe like one patient in when figuring out what the agenda is. That way we can maybe start off with, okay, let's engage the patients first, see what they have to say, and then, okay, and then let's cover what we wanted to talk about, but also weave in what the patients thought. I don't know if that answers your question.
Absolutely. That makes complete sense. And I guess a follow-up was, did you observe there to be any change over time? Because you looked at four sequential meetings. Did the structure change at all? Did you observe any kind of differences in how folks are participating?
Yeah, actually, I think the last two meetings, I would say patients definitely were more vocal throughout the meetings. I guess it's just the matter of fact of like what the study researchers are then like doing with that information. Are they actually like considering it, or it's like, okay, here's your time to talk, and then we'll see if like these outcomes actually cater to what the patients like spoke up about, I think is still an issue I saw occurring throughout the meetings.
Can you say more about that?
Um, like talking about like what patients would be comfortable with in this like mental health app design. So it would be like 20 minutes of just patients speaking and like researchers and facilitators not really saying anything back. It would just be like, okay, thanks for sharing, and like,
Mhm,
end it there.
mhm, mhm. Yeah, that makes sense. So you were left with that question of what was going to happen with that information. Yeah. Okay. Thank you so much for your observations.
Thank you.
And I'll jump in some comments. So thank you, Marcella. Like really, really nice work. Nicely presented as well. So I'm really interested in your interest in implementation science and industry. And it sounds like you've already made one connection. Um, but I think there are like multiple different pathways for implementation science um, in different aspects of healthcare. Like one of our former faculty is in behavioral health. Another postdoc that we mentored is in pharma. And we heard from some of those people at our seminar, but also there are what's called purveyor organizations. So people that focus on helping um, intervention developers, kind of bridging between the intervention developer and the end users.
Yeah.
Um, so the purveyors. So I'm just wondering kind of what your thoughts are about, is there a specific area of health or, device, pharma, um, that is of interest to you, or is it kind of a wide open field right now for you? And kind of thinking through where you might be able to um, really support implementation.
Yeah, great questions and great insight. Thank you for that. I think I would say it's still a pretty wide lens, but I touched about kind of the topic of compassionate use programs. I'm not exactly sure how DNI would be able to be part of that step, but seeing like how these patients are getting these drugs that aren't put on the market yet, right? And I think using DNI methodologies to kind of see like, okay, what's the safety for patients behind this? What's the process of getting these drugs to these patients? And what's like how effective is it? I don't know if there's like a specific um, field specifically for that, but I'm sort of leaning towards that as of right now. But I think I'm still exploring like the biotech industry in general.
Yeah. Well, fortunately, you don't have to make a decision this week.
Right.
But also some of what you're mentioning, it's just I'm reflecting on Keisla's interest as well in health disparities and it seems like what you were talking about could cross over in terms of access as you were talking about.
Yeah.
So I really appreciate that. Thank you.
Thank you.
Right. Grace, I see your questions in the chat. Do you want to unmute and ask?
Yeah, hello everyone. Sorry, my name is Grace Lozano. I'm also an implementation postbac at University of North Carolina, working on genetic screening programs. And we do a lot of community engagement and just listening to your work on the listening sessions. I was wondering what was the capacity, or I don't know if I missed this, but if you conducted these sessions in Spanish or in other languages, and if so, what was the capacity to analyzing and collecting that feedback?
Yeah, great question. Isaac, Kara, feel free to jump in. But I know for the patients who were of Arabic speaking and Spanish speaking, we did have a translator in those meetings. It was a predominantly English patients who were speaking. I don't know if this answers your question. Isaac, you can jump in if you need to.
Yeah, so there was an earlier part of the study where we had these cognitive interview sessions, and so they were split up by language. And so there were instances where we did only have like monolingual speakers in Spanish, Arabic. And so for those instances, we did have the researchers and like translators in the meetings to translate content. For the interviews that Marcella analyzed, there were only English speakers in that case. But we did have some instances where there was Spanish and Arabic language. So for example, we did have translators help translate that content after the interviews too.
Thank you.
Hey, Jake, I see a question in the chat. Do you want to unmute or would you prefer to use the chat? Okay. So Jake asks, this is for you, Marcella. Did you experience any difficulties, limitations, or outliers in pursuit of your research and work? And are there any changes or different approaches that you would take? Great question.
I think challenges, I don't know if I would say this was a challenge, but kind of piggybacking off what Keisla said, the documentation process was really tedious, but I think because you have to, there's like no shortcuts to it. Like when we first started, Isaac was like, there is no shortcuts getting around this. Like you just have to get through the meeting, pause and record each second, whoever's speaking, which was overwhelming at first, but I think as we went on throughout all the four meetings, you kind of get your own routine and you go through it. I don't think there was any major challenge that I came across. Maybe when like coding, you don't really know exactly like what the speaker which theme it might fit in. So Isaac would kind of like cross-check that sometimes just to make sure like, okay, yeah, like we agreed on this. So that was one thing. What was the other half of the question? I'm so sorry.
Yeah. Are there any changes or different approaches you would take, I guess, in pursuit of your research or your work?
I don't think there's any different approaches I would take, but I could definitely see how this ethnographic approach was able to really open up seeing like the behavioral and structural barriers between patients and study researchers, which I think was really interesting. That I think I will carry a long way with me if I ever use this methodology again.
Keisla, I think this is actually a good question for you as well. Are there any changes or different approaches that you could see in your future research, your work, and your pursuit?
I think maybe since I've working on both these projects, I found that I was approaching Musty similarly as I did with EPIS, but I realized that I couldn't do it like that because when I would do my EPIS research, like going through the articles, I would normally have like a show playing in the background or music. And because it didn't take too much focus for me to read through the abstract or the title or skim through the articles. But for the Musty project, the documentation, going through the meetings and um, less with the coding, but going through the meetings, I definitely did need to sit down and take the time to focus on things because I found myself redoing work that I shouldn't have had to if I just focused. So that's one thing I would have changed. I would have approached it differently, but I didn't know that. So when I did, that's when I changed my process. But yes, that's my only challenge. But
Great.
you learn.
I feel like that's kind of a common theme in implementation research, and I think research in general is that we find what works and what doesn't, and if you need to pivot, then you pivot, and you learn from your experiences. So I love that. Great. So we are almost at the end of the hour. However, I wanted to just thank Marcella and Keisla so much for agreeing to participate and present on the work that they've done. And I just want to say it's been such a pleasure to work with you guys. I have learned so much from you guys, and I hope that you have learned something from the disc, which it seems like you have for sure. But I'm just so thankful for the opportunity to be able to work with you guys, and I'm very excited to see where the future takes you guys.
Thank you, Kara. And thank you everyone for joining.
Okay, I will let you guys go. We will have the recording posted on our website. And then after the call, you will be prompted to take a satisfaction survey. So just let us know what you thought of today's presentation. And I hope you guys have a wonderful holiday break. And we will see you in the new year. Thanks, everyone.